Our brand, the Blue Cross Blue Shield brand, is so important in the lives of millions of people. 1 in 3 Americans depend on us every single day to get their highest quality of health care for their children, for their parents, for themselves, for their partners. And we have a responsibility to make sure that we fulfill that promise under this wonderful brand, the Cross and the Shield. Our focus is on what we call patient-centered innovation, putting the patient at the middle of everything we do. The provider and the insurer work hand in hand, interacting with the member, giving the primary care physician and the specialist the real-time data they need to ensure that that patient is getting what they need at the time they need it. We developed a system called Facilitated Health Networks. Our Chief Medical Officer and his team work aggressively with the provider network to develop contracts where we pay for value. And if we together care for a patient in a way that the outcomes are significantly better, everybody shares in the savings. And most importantly, we have better outcomes for our millions of members. One of our largest providers, the Hospital University of Pennsylvania, they are guaranteeing for a 30-day period of time any readmission they will pay for. And they're putting their necks on the line with us. So it's an incentive for both of us to make sure we have the care pathways together. I'm so proud of the Blue Cross Blue Shield Association for working with each of the individual plans, taking a stand about opioid addiction. Friends of my children, just far too many of them, have been taken down by addiction, and oftentimes an opioid. We've had it in our family, and truly understand that this is a disease. We have made this one of our key efforts to get into the communities and not only educate, but work with the primary care physicians to ensure that the prescribing patterns do not overutilize these drugs. They're miracle drugs, but when abused, they're killers. What inspires me every day is that feeling that what I do, what my colleagues do along with me, matters and impacts the lives of people who access us, access our services at the most vulnerable times in their lives. Healthcare is a right. It excites me to work with the Blue Cross Blue Shield Association to impact public policy in a way that we hope will give access to quality care to every single American, and that excites me more than anything I do on a daily basis.